Every time you're about to breastfeed, always make sure to be comfortable, using the pillows and cushions to actually support your back, arms and/or the baby. Whichever position you decide to breastfeed, you always have to make sure that the baby is aligned, which means that the head, the shoulders and the spine of the baby should be on the same line. When you position the baby on the breast, your nipple and the nose of the baby should also be on the same line. You stimulate the baby's upper lip, you wait for the baby to have a big open mouth, and then you attempt the latch. The wider the mouth, the better the latch. The first thing that touches your breast should be the baby's chin, and so it should continue through all the breastfeeding. This way, the breastfeeding will be pain-free, and this is how you know that the latch is correct. Pumping is a great way to stimulate and drain your breast. The best time to start pumping, it depends on the reason you want to start pumping for. If you decide to start pumping because you're going to work or whatever reason during a well-established breastfeeding, pumping can be started at any time. If in other case your baby is ill or there is a separation between you and the baby after the birth, then the recommendation is to start pumping the soonest, between 1 to 6 hours after the delivery. A term and healthy baby should be breastfed on demand, which means that the baby will request food whenever hungry. A term baby requests food 8 to 12 times in 24 hours, and it doesn't actually follow a time schedule unless medically indicated. It's recommended to exclusively breastfeed your baby for the first 6 months of his life and to continue breastfeeding up to 2 years and beyond as per the mother's or the baby wish, obviously with the introductions of solid food as recommended. There are a few recommended steps to boost your milk supply. Breastfeeding on demand, because the demand will actually augment your supply as per the baby's needs. Achieve always a good latch. Offer the baby both breasts. Pump, which can be done in different ways, right after the baby has breastfed, in between feeds or power pumping. Always refers to professional if you have any doubts and queries. Have a healthy diet and drink plenty of water. If you're in pain during breastfeeding, it means that the latch is incorrect. This issue has to always be addressed. If you cannot manage to adjust it yourself, then please refer to a professional that can help you. If the pain is actually during a pumping session, then there are a few things that you can do. One is to always check the right size of the flange that you are using, because these will improve with the pain and actually to drain the breast correctly. And the second one is to check the settings of your pump, because high intensity does not always mean more volume of milk coming out, especially if painful. A breast engorgement is due to an imbalance between stimulation and drainage of the breast. An engorged breast feels painful and hard. The solution that you can follow to actually help this moment is to warm up your breast with warm compresses, massage it and soften it prior to the feed. You feed your baby more often or you express more often, so to help milk coming out. You can use painkillers and anti-inflammatories to help with the pain and the swelling. And if after milk extractions your breast still feels uncomfortable, you can use cold compresses 2 to 3 times per day to help you feel some relief and with the swelling. Thank you.